Tonight, the World Health Organization declaring a global health emergency as cases of Ebola virus surge in Africa. International health agencies now preparing a large-scale response to an outbreak that may be difficult to trace.
Currently, I'm on panic mode because people are dying.
First identified in the Democratic Republic of Congo with at least 336 suspected cases and more than 85 suspected deaths since April.
Me as a Ugandan, I'm really frightened.
These latest cases tied to the Bundibugyo strain of the virus, for which health officials say there is no approved vaccine or treatment. In the US, the CDC saying the risk to Americans is low, but not confirming whether any Americans in the region may already be infected.
The spread of Ebola is primarily person to person with contact of fluids, body fluids, secretions, saliva, etc. It does come with a high mortality rate, a high transmission rate.
All this as hantavirus continues to be a concern. Canadian health officials say a passenger that was on board the infected cruise ship has tested positive. That individual and their spouse, who is showing mild symptoms of the rare but deadly virus, are now in isolation at a hospital in Canada. However, health officials in Washington state are looking into 6 potential exposure cases. Tomorrow, the remaining cruise staff and crew will disembark in the Netherlands. Afterwards, the ship expected to be cleaned and disinfected. Keir Simmons, NBC News.
A rare strain of the Ebola virus is suspected of causing at least 80 deaths in the Congo and Uganda. Hundreds more may be infected. The UN's health organization has now declared a global emergency. Let's bring in ABC's Alex Perez on that. And Alex, I know you also have news about that deadly hantavirus outbreak. What's the latest?
Well, Lindsay, as of Friday, 18 passengers remain here under observation at the University of Nebraska's biocontainment unit. Now, Canada has confirmed, authorities there have confirmed that a Canadian citizen who was also on the cruise ship has tested positive for hantavirus. Now, the CDC says there have been no confirmed hantavirus cases in the U.S. connected to that cruise ship outbreak. In all, there have been 11 confirmed hantavirus cases linked to the MV Handia ship. 3 people have died. All this as authorities with the World Health Organization have declared the deadly Ebola outbreak in the Democratic Republic of Congo and Uganda a public health emergency of international concern. Under President Trump, the U.S. pulled out of the World Health Organization. And Lindsay, the CDC says the risk to the American public remains low. Lindsay?
All right, Alex, thank you.
There are growing concerns about a rare and deadly strain of Ebola in Africa that's prompted officials to declare a global health emergency. At least 6 Americans there have been exposed as health officials urgently try to contain the spread. CBS News medical correspondent Dr. Celine Gounder spent 2 months working in West Africa during the 2014 to 2016 Ebola outbreak. She's also the editor-at-large for public health at KFF Health News and joins us now. Doctor, good to see you. What do we know about these Americans and their infection?
So we know there are at least 6 who are being monitored as contacts. 3 of them are considered high-risk contacts, so significant exposure. And 1 of those contacts has already developed symptoms. We don't know yet where they will be evacuated to for medical care. Some of the sites with experience in the United States include Bellevue Hospital here in New York City, Emory in Atlanta, the University of Nebraska Medical Center, but Nebraska is already taxed with all of the hantavirus contacts, so they're not going to be able to take these folks.
And for those of us here at home in America, should we be concerned about Ebola?
Well, I do want to point out the minerals in your smartphones are from this part of the world. So you may not care so much about the risk to yourself health-wise, but there are very real reasons this matters to all of us in terms of economics and so on. The risk to Americans right now is very low. Ebola is not something that spreads through the air. You have to have direct contact with somebody, their bodily fluids. You cannot catch this from someone before they show symptoms. But at the same time, if we allow this to spread uncontained, that does start to pose risk.
And also what's interesting about this is a rare form of Ebola. Of course, there is no vaccine. So how is that complicating the effort to treat these patients?
Yeah, this species is called Bundibugyo. There are no vaccines, no treatments for this. And in the absence of USAID funding for the people to respond on the ground, we've pulled out of WHO. We have a lot fewer of the tools we would normally have to respond.
That's a really important point. Dr. Celine Gounder, thanks so much for your expertise.
Ebola. There's another viral outbreak, and this one has caused 80 people to pass away in the Democratic Republic of Congo. That number is now up to at least 88, and the World Health Organization has declared Ebola a public health emergency of international concern. I don't make the medical news, I just deliver. I'm Dr. Frieda, and I'm going to break down exactly what Ebola is. I'll tell you about this recent outbreak. I'll let you know the signs and symptoms. I'll talk to you about how it is transmitted. I'll give you the incubation period. I'll tell you the mortality rate. We'll talk prevention. We'll talk treatment. But then I'm going to hit you with something, because there's something that honestly is quite worrisome about the specific strain of Ebola virus that is causing the current outbreak. Just wait to the end. I'll tell you. So on Friday, May 15th, it was reported that there was an Ebola outbreak. And at that time, there were 65 people who had passed away and 246 suspected cases. As of Saturday, the outbreak has spread to Uganda. Ebola is a virus that is quite deadly, to be honest. It starts off with dry symptoms such as fever, fatigue, body aches, and then it progresses to wet symptoms, which include vomiting, diarrhea, bleeding. If you are exposed to Ebola, you can develop symptoms anywhere from 2 to 21 days, but most people develop symptoms between 8 and 10 days. How is it transmitted? Through bodily fluids. Ebola is present in blood, urine, feces, breast milk, semen, vaginal fluids. The mortality rate of Ebola is abysmal. It's anywhere from 80 to 90%. It's actually as high as 90%. The average mortality rate is 50%. In order to prevent getting Ebola, you definitely want to avoid being around people who have it unless you have on proper protective equipment. Avoid any bedding, sheets, clothing. And we actually do have an FDA-approved vaccine for Ebola. But here's the thing, and here's the twist. The vaccine we have is only for the Zarense strain. This is the strain that most commonly causes Ebola. But here's the issue. The current strain that's causing the outbreak, it's the Bundibugyo strain. And we do not have an FDA-approved vaccine for this current strain. Oh, and then let's talk treatment. We actually have 2 FDA-approved treatments for Ebola. But again, it's for the Zarense strain, not for this current strain. It brings me no joy to share news of another outbreak. But as always, I will keep you updated. And if you enjoy evidence-based medical information like this, please give me a follow and subscribe.
This won't be the last pandemic that we face. You know, pandemics can come from natural causes, which is largely coming across from other species. You know, a flu, for example, is still a very big risk. And so we'll have to invest in making sure that we catch the disease sooner and that we have platforms to make diagnostics, therapeutics, and vaccines very quickly. Very little was invested, even though there were these calls by a lot of people, including our foundation. One group that was funded, the Coalition for Epidemic Preparedness Innovation, CEPI, C-E-P-I, we, Wellcome Trust, Norway, UK, Japan were the initial funders, and that is helping out here. So we're better off than if that hadn't happened. But, you know, people trust government to think through these eventual bad things. This was a failure to get ready, and the cost would have been tiny compared to, say, what we spend on being ready for war. We didn't actually do the simulation to think about, okay, what about nursing homes? What about getting factories ready? What about the testing regime? You know, in fact, the testing could have been ramped up very quickly, and a few countries that have almost avoided the epidemic entirely, like Taiwan, New Zealand, Australia, you know, they took their experience and actually prepared, and so they moved a lot faster. So we, you know, we'll have to prepare for the next one. That, you know, I'd say is will get attention this time.
From May through July, ticks run rampant in wooded areas across Wisconsin. ThedaCare says cases of Lyme disease from ticks have raised in recent years.
We have a lot of parks and even in urban areas and suburban areas, people are getting outdoors more, taking their dogs for a walk, and there's certainly a lot more prevalence just statistically because we're more aware of it.
Biology professor Shelley Mahalski at UW-Oshkosh says on top of awareness, there's an environmental reason for the uptick.
Ticks are spreading, and part of this is climate change. And I've actually done studies on this where we established that in our area, in the Oshkosh area, usually you see American dog ticks, and they don't carry a lot of diseases, but we are seeing more and more deer ticks come over the Wisconsin River.
Dr. William Cumpry says if you're bitten by a tick, the chance of getting Lyme disease is 1 to 2%. That doesn't mean preventative measures shouldn't be taken.
So light clothing, hats, but when you do your tick check, be thorough. I mean, the ones that transmit most of the disease are the nymphs. They're very tiny. So it's more prevention than spotting.
Cumpry added the symptoms of Lyme disease include a growing rash and flu-like symptoms, fevers, chills, body aches, stiff necks. Mahalski says if you feel those symptoms, go to a doctor immediately, but don't just leave the tick behind.
If you get a tick on you and you think it's bitten you, keep the tick. Put it in a plastic bag or in a jar, and you can take it to your doctor, and they will be able to identify the tick and tell you what risks you have for disease.
In the Fox Valley, Josh Cavender, Fox 11 News.